Hello, Tatiana. Thank you very much for being here with us today. Make Mothers Matter represents a mother organization and Promundo is a father organization. So mothers and fathers together. I'm really happy and honored to share this discussion with you. Could you please start to introduce a little bit yourself? What is your role at Promundo? How long are you, since when are you working there? What do they do exactly? And et cetera, et cetera.
Well, thank you, Laurence, and Make Mothers Matter for the invitation. It's good to see you again. My name is Tatiana Moura. I'm from Portugal originally, and I joined Promundo as the executive director of Promundo in Brazil in 2011. I stayed there until early 2019. Then I came back to Portugal, and now I coordinate the work of Promundo Portugal. In Portugal, we are hosted by the University of Coimbra, in the center of Portugal, more precisely at the Center for Social Studies. So here we combine a lot of research-oriented projects with programs and gender transformative methodologies in Portugal. So I met Promundo 15 years ago, 2005, I think, in Brazil, but I only became a formal staff member in 2011. And yes, and it's good because you work on motherhood, we work on fatherhood, but also on masculinities, of course. So it's also good to bring this perspective to the work that you do and learn from you.
And when was Promundo created? How long do they already exist?
Promundo was created in 1997 in Brazil, first in Brasilia, but then 2 years after they moved to Rio. And we're not an international NGO formally. No. We are a consortium. We are national organizations and we are part of an international consortium. So we have a different model on how to operate. So the first office was created in Brazil in 97, the second office in 2011 in Washington, DC, the third office in DRC, Congo. It's called the Living Peace Institute and works with former combatants, mostly focused on trauma issues. And then Promundo in Portugal in 2014. We then work with international partners, namely in Chile, in Spain. We have now a formal office in Spain created in the end of last year. So it's an international consortium of national organizations.
Yeah, and it's a worldwide, with a worldwide network anyway of contacts everywhere. That's
yes. Promundo also co-founded the Men Engage Global Network. That has more than 800 members, organizations, and individuals all around the world. So we're a big
800.
Network.
Okay, that's something that we can be jealous of. Absolutely. Okay, and so we say that mothers need fathers. Of course, mothers and fathers have to work hand in hand for the education of their children. And what we see is that when fathers are much more involved and take part of the unpaid family care work, of course, mothers have more time to go to work. They have time to earn their money themselves. They do their own business activities. And like we see here with Mulheres, Obra, it's very important, of course, for women to develop their activities. Is it like this worldwide? Do you see the same evolution not only in the Western countries? You see that everywhere?
Yes. And we have different lines of work or areas of work. Fatherhood and caregiving is one of the areas we work on. And in every country where we work on that specific area, we have programs on fatherhood and caregiving, we see the same results. So being in terms of research projects that we have, namely our International Men and Gender Equality Survey, it's the Images study in more than 50 countries all around the world, shows us that the more men are involved in unpaid care work and domestic tasks, the happier the couple is, the more equal family they raise, their sons will be more pro-feminists and more gender equal boys and men, and the same in terms of self-esteem of their daughters. So the results in terms of research and in terms of the impact evaluation of our interventions, they are quite similar. So it's a good strategy, because we started to focus on fatherhood and caregiving as a strategy to engage men. The main objective of Promundo is to promote gender equality by targeting and looking at boys and men to promote gender equality. And based on our research, we saw that focusing on fatherhood and caregiving was a good strategy and is a specific component and issue that needs to be considered. Because not every man understands the concept of gender equality. No. You know, sometimes it can be quite abstract and they like turn off the chip. But if you talk about fatherhood and caregiving, it's something that relates and connects to them, because
much more.
They all had fathers, present or not. They are caregivers or they are biological fathers. So it's something that they understand that has specific impacts in the lives of their children or their wives, and on their own, you know, self-care and their own life. So yes, basically it's like a cross-cutting issue.
And how do you then put in place programs, or how do you organize your advocacy work, like in Portugal, for example, with the fathers? How do you do that? You just speak a lot in the media, you have programs to educate fathers. Do they come to these programs? Are they willing to change? Are they ready to change?
Yes, they are. Of course, it's an interesting question, and the idea of focusing in Portugal is a good idea. We're just finishing a program, an European program. It's called the Parent Project, and it is an EU-funded project, funded by the Rights, Equality and Citizenship Program, and it's an international project. The Parent Project is Portugal, Italy, Austria, and Lithuania. And the main objective of the project started in January 2019, and the objective was to adapt the methodologies that we developed in Latin America, namely Program P, focusing on P for Pai and Padre. So the adaptation at European level was called the Parent Program. And so we adapted and developed these projects nationally. In Portugal, what we saw, and it was a strategy that we also used in Brazil and other countries, is that the work on fatherhood and caregiving is, in that kind of work, is strategic to partner with the health sector. So we partnered with the health ministry in Portugal, and together they have a government program called IMPEC. Let me say it in Portuguese. IMPEC means Iniciativa Mobilizadora da Paternidade Envolvida e Cuidadora. So it's a national program from the Ministry of Health to promote fatherhood and care, engaged fatherhood and caregiving. And so it was a very happy marriage that we partner, and we developed together this methodology. So the project was focused on mobilizing groups of fathers, because what you have usually are these parent pregnancy courses, no? Prenatal courses and workshops, mostly focused on women and on pregnant women. And we saw that men, they wanted to ask their questions, but they don't feel empowered to ask those questions when they have couple sessions. So the group started like this. So we have the father groups component, we have the training of health professionals, and because of the pandemics we had to go online, and it was interesting because of course face-to-face is more effective and more interesting, but going online meant that we reached health professionals at the national level. So we reached
it's much easier to assist, of course.
To assist, to attend. We trained around 100 health professionals in Portugal, And of course, we included an ECD component, so an early childhood development component, so that things can like be multi-sectorial, and the health sector can dialogue with the ECD and education sector. And we developed a campaign, a national campaign and an European campaign, the Man Care. So that was our strategy here. The project will be, all the materials will be launched in the end of June.
Okay,
so in 1 month.
Not launched, something to look forward
we'll
here
have
for
the
audience
manual,
then.
The national manual. It's yes, we will send you the invitation and we'll put on our networks and social networks. So we will launch the manual parent for Portugal, but also the European manual parent in English, with specific inputs and tips if you want to work or you are a health professional, if you're a social worker, if you're a father. And we'll also have a digital platform. So lots of good things next month.
Yeah, and that will launched only in those 4 countries, or well, in whole Europe?
Of course, in these four countries, you have national organizations that will organize the national launch. But since it is a EU-funded project, of course, we hope that European Commission will also use these materials as their own materials. And so when we say we're launching, it's at the European level, of course, and now everything is digital and online. So it's
but because I am I am the head of Make Mothers Matter Belgium, actually, I was wondering, will there be something in Belgium specifically? You don't know yet.
We will invite EPs and we will invite our program officers from the European Commission. But the face-to-face event was planned in the beginning, and we did that without the projects. This year is quite tough to do that. So perhaps not this year, but maybe next year we can think about having something there. Also, because we were supported by the European Parliament to do a research that is called the State of Europe's Fathers. It's already online.
Okay.
And
only for Europe.
Yeah, only for analyzing data from Europe. State of Europe's Fathers.
I don't know if you remember or if you know that the first State of Fathers worldwide with MMM, we presented at the European Parliament. I think it was in 2015 or 16.
16. It was 16. So this is like a son or a daughter of the State of the World's Fathers. State of the World's Fathers started in 2015. The first one. Then every 2 years we launch one State of the World's Fathers. Next month, also in June, it will be launched. So 15, 17, 9, the 4th State of the World's Fathers. The World's Fathers. So, but this one that was launched on March the 19th, it was Father's Day in Portugal, was supported by Portuguese European parliamentaries. So it was Father's Day in Portugal, and it is focused on data in Europe.
From Europe.
So you can find it online.
And then to come back a little bit to the fathers exactly, and their unpaid family care work that should be done equally by mothers and fathers, of course. During COVID, we saw actually many fathers realized finally what is the heavy work that mothers are doing at home. And there was a change. I mean, of course, the unpaid family care work load was very heavy for both parents, because it was not only doing the usual things, but it was homeschooling, children being at home for weeks sometimes, and combining these home children with home working wasn't easy. We saw some good results of fathers that were very much involved in this family care work. How can we now keep this up and try not to lose all these good efforts after COVID times? Do you think this has been a radical change in mentalities for many people? Do you have data, or do you see things already changing a lot on this, or not really?
I think that change needs time. I think it was a
like
good
always.
a good start. I think it was a good starting point, and I think it was a good opportunity. And it is a good opportunity.
Definitely.
What data shows is that the effects of the pandemics was heavier for women than for men. And when you asked men and women, men, those who are fathers, they said not that it was a good experience, but they reported or self-reported that it was a much better experience than for women. So women self-reported a very negative experience, and fathers self-reported a positive experience. And this takes us, I mean, we need to think what these data mean. That sometimes you need to think about the type of engagement. So the type of engagement, like spending more time at home, doesn't mean that the quality of the engagement has increased, because we know that men and fathers still spend more time playing with the kids, doing that kind of tasks, and the mental load for women is heavier. Also, when you look at studies on burnout, parental burnout, it's heavier for women and mothers than for fathers. So we need to take some conclusions from that data. This said, I think that it is a good opportunity for mind changing and for transformation. But this needs to be decided or seconded or supported by public policies, namely in terms of paternity leave, namely in terms of sharing the care work during the life of the children, when the children is sick, when so I think if this is not supported by public policies, it's like just an exception, you know, time, like some period of time where men were able to spend more time at home, and now everything goes back to the same. I don't believe that the world changed. The world changed in terms of working from home, in terms of workloads. We still need to reframe, I don't know, the way we work and we live our lives, and the balance, the work-life balance, because that was at the moment that this is a mess. This is a mess. Everything is very, very tiny, you know, lines and frontiers. So we need to reframe the way we behaved and worked and dedicated ourselves to our families and spent time at home. But I think the pandemics, putting aside, of course, all the negative effects and everything, was a good opportunity to make fathers stay at home. Even those, and I think it was a good experience precisely for those who wanted to stay at home, but because of social norms,
social pressure,
their employers, their bosses, the company environment, etc., weren't allowed to stay. So I think that for those, it was an excellent opportunity. It was a backlash in terms of, for example, fathers' presence in maternities. So during births and deliveries, and the first, I'm not sure how it was in every country in the world, but in Portugal, one of the first things regarding prenatal and postnatal, you know, health policies was to stop the father's presence, to forbid the father's presence.
That was a big problem in all the countries, I think. Many hospitals in Belgium, it was the same during the first wave. A lot of parents were not even allowed to enter the delivery rooms. This is horrible.
And if you think about that, this is an indicator. Because it means that father is not considered part of the process. Father is a visit, and that kind of mentality doesn't support, you know, our struggle for gender equality and and promoting caring masculinities and co-responsible fatherhood. and caregiving. And now things changed, at least in Portugal, but it was amazing and a shame, and it was impressive how this was one of the first, measures. The friends and the fathers, they only met their sons and daughters when mothers left
hospital.
Maternity. The mothers, they were alone there in a very difficult moment and very sensitive moment of their lives. So I think it was, answering your question, it was an opportunity. Of course, we need to look at data, we need to look at the symbolic messages, and we need to avoid these kind of backlashes in the future, because we also know that violence against women and violence against children increased all over the world during the pandemics. So for on the one side, I think you have new practices and daily lives that can support positive coping in terms of gender equality and resilience. But on the other side, we also need to look at that data, because people were like locked down in an environment where they couldn't live. So we need to work on the opportunities, and
absolutely
we need to answer the negative effects.
The negative effects have to be pointed as well, and we have to work with those negative effects definitely as well. But it's encouraging when we hear that there were some positive sides at this terrible worldwide pandemic as well. So that's
yes.
So there were some positive signs as well. And then, so we spoke now a lot about Portugal, about Europe, and worldwide, you really try to promote this gender equality and prevent the violence that you quickly spoke about now. What are your findings on this? How do you, beside the COVID pandemic, but in general, how do you work with that? And you have programs in other countries as well, worldwide for addressing this.
Yes, we have programs using almost every letter of the alphabet. It's a joke, because our programs use the first letter of the name. So, for example, we started by developing program H&M for Homem and Mulher, men and women. So we started in 1999, 2000 in Brazil, developing these gender transformative programs targeting youth. So working with boys and girls from starting at the age of 12 up to 18. And we have this,
in schools.
In schools and in activities out of school. So, for example, at the community level, we started in favelas, in poor communities in Rio. So, not specifically in schools. Then, of course, we started in schools because we wanted to scale up our methodologies and interventions in order so that they could become a program at the national level, promoting gender equality in schools. So I'm let me tell you about our programs that are adapted worldwide. So not giving specific or national examples. So then we have program P, working on fatherhood and caregiving. We have program J in Brazil, youth, jovem. So focusing on youth, and it's called Youth Living Peace. It was a project in Brazil and the DRC, and the idea was to work on secondary prevention of violence, so targeting youth, young boys and girls who were victims of violence and or authors of violence. So secondary prevention of both. And tertiary prevention of violence. We started recently a program at European level. It's called Kinder, what we call program K, because what we see is that starting at the age of 12, it's too late. It's too late. Oh, wow. Yes, because gender stereotypes, it was launched a study, an OECD study, very interesting, research focusing on children at the age of 5. Gender stereotypes at the age of 5 in 3 countries. It was US, UK, and another country I can't recall. 4,000 kids were part of this research, and this study and others showed that at the age of 5, boys have much more rigid gender norms than girls.
Oh, really?
So, and at the age of 3, you already start to express this gender stereotypes. So we decided to create this program at European level. It's called Kinder, starting at the age of 3 up to the age of 12. And we're working with education professionals and families, because you know that the backlashes in political terms in the world sometimes makes this, this kind of resistance to gender equality movements and what they call gender ideology. So you need to start also work with the families and schools. And at the same time, Promundo US started this global program. It's called the Global Boyhood Initiative. It's a partnership with the Gina Davis Institute and with the Cummins Foundation. So we kind of merged these two approaches. These ones in the US, they already started in the US, and then Promundo will also start in the UK, France, and from our side, I mean, coordinated from Portugal, is Portugal, Spain, and Croatia. So it's like a big consortium developing this new approach. And we have a the methodology developed in Congo. It's the Living Peace methodology. So it's the focus is on trauma and former combatants from Rwanda and DRC. And so it has a lot to do with the program on fatherhood and caregiving, and debates and trainings on the need to share caregiving and domestic tasks. So it's been quite successful in Rwanda and in DRC, but it's their speciality because, of course, you know all the characteristics of that civil wars and wars and the need to engage men in the aftermath of wars. So, but basically, in very, very general terms, we also work on women's economic empowerment. We had a project in Rwanda and then one in Brazil, working with women and men, but women who were beneficiaries of microcredit programs, and in Brazil of conditional cash transfer, the Bolsa Familia. And so what we saw in Rwanda was that you need to engage men on these discussions and debates. Otherwise, women will be the beneficiary, but at home, men will decide how to use the money, etc. So if you engage them and you explain, and if they're both engaged and sharing domestic tasks and sharing, caregiving, in the end, as a couple and as a family, of course, the outputs will be much better. And the same with Bolsa Familia in Brazil.
Very good. Very impressive what you're all doing worldwide, and ideas are coming up with members of us in RDC. So we definitely will have another talk offline on your programs in Congo. That's really very interesting. And to conclude a bit this discussion, would you have any other advice to the working mothers of your country, even in Portuguese, if you want to tell them something, or of course, with this new program coming up in June, there will be a lot to communicate, but I'm sure if you can address a message to these ladies in your country, what would you tell them?
Let me think. You know, there are several studies that show that what makes life difficult for women workers are not their children, but their husbands. So what blocks women around the world, working mothers around the world, are men, not children. Because it's an interesting data, because if you're, for example, if you're alone with your children, you kind of create a network of solidarity among family members and other women and friends, etc. So if you have a partner, a father or a caregiver there that doesn't share domestic tasks and caregiving tasks with you. This is what blocks you. So if you feel like you're not sharing equally at home these tasks, you need to talk with them. You need to talk and you need to convince them that it's not only because of you, but because of your children. Because if your children grow up seeing a father or a male reference being equal, they will engage in much healthier relationships. They will be happier kids, and they will and sometimes it has the power to break cycles of violence, and they will be happier in schools. They will have better school performance, etc. So you need to convince men around you, not only your partner, but your brother, your father, your whatever, that sharing unpaid care work is good also for their health, because we know that data shows that men who care, they take care of their own health and they live longer. So it's a good, it's a good thing to tell men around you, to convince them and to make society better. It's not. That would be my suggestion.
Thank you very much. It was a very interesting talk. I hope the whole audience will have had some interesting information that they didn't know. Maybe if you can mention just a website or any place where they can find probably on Facebook, and where they can find the information.
On Facebook, you can find us in Promundo Global, as Promundo Global. If you want to check our website, is promundoglobal.org. Facebook is Promundo Portugal, if you're interested in the work that we do here. And if you want to contact me directly, is t.moura, MOURA, @promundoglobal.org.